everyone, welcome back to my channel. I'm Dr. Durga Singh and we are into the last segment of barium studies, that is barium enema. This is important as well as confusing as it can diagnose a vast majority of colon pathology. It is also one of the higher topic from exam point of view. So let's proceed further. So, barium enema. We already know what's the procedure of doing barium enema and the structures we see there. If you haven't watched my introductory video, then I recommend you to watch the introduction. Now, first of all, I want you to learn about normal barium enema film. Let's see. Look, this is the normal barium enema film, where we can visualize the ascending colon, the transverse colon, descending colon, sigmoid colon, rectum very easily. I will come back to this slide again. Let's look at the normal anatomy of large intestine first to understand it better. Can you appreciate these outpouchings? These are known as haustra. Actually, the longitudinal layer of muscle is unusual in large intestine. Most of the fibers in it are collected to form three thick bands, the tinea coli. A thin layer of longitudinal fibers is present in the intervals between the tinea. The tinea are shorter in length than other layers of the wall of the colon. This results in the production of sacculations or haustrations on the wall of the colon. Filling and distension of one haustrum leads to the contraction of smooth muscle to push the contents into the next haustrum. See, these are the semilunar folds. Actually, these folds arise in the inner surface through muscle contractions. These are merely caused functionally and therefore movable. These folds form pouches on external surfaces, that is, haustra. Now, again see the normal barium enema film. Hope you can appreciate the haustrations properly now and realize how small intestine and large intestine can be distinguished on barium films. Now let's proceed further. I will show you few colon pathologies easily visualized on barium enema. They are sigmoid volvulus, intussusception, diverticulosis of the colon, ulcerative colitis, hirschsprung disease, and carcinoma colon. Moving forward, see this question. An elderly female suffering with a known psychiatric illness comes to the emergency department at 4 a.m. with complaints of vomiting, massive gaseous abdominal distension, pain abdomen, and features of obstipation. What's the first investigation you will do? Now, see this picture. This is not barium film. You can't see any contrast here. This is plain X-ray abdomen. Can you see a coffee bean there? This is known as the coffee bean sign or omega sign or bent inner tube sign or tire tube sign. I know you must have guessed what's the diagnosis. Yes, that's sigmoid volvulus. Sigmoid volvulus means twisting of sigmoid colon over its mesocolon. The sigmoid colon gets distended, dilated because of the volvulus. You can appreciate the inferior convergence on the left with a haustral margin. Remember, if opening of the cleft is towards the right side, we are dealing with the cecal volvulus. Now, I want you to see this, how it looks on barium enema. See this film. Can you see a bird beak? Yes, that's bird beak or bird of prey sign. Here, the contrast-filled rectum illustrates the bird's beak, corresponding to the luminal narrowing at the site of sigmoid obstruction. Barium can't cross this twist point. This is the characteristic presentation of a sigmoid volvulus. Now remember, the investigation of choice for sigmoid volvulus is not plain X-ray abdomen or barium enema. It's contrast-enhanced CT scan. Now about the management of this patient, you should know how will you manage the patient if she is stable without peritonitis, and what if the patient has perforation peritonitis, what's Hartmann procedure, etc. You will learn this in surgery and you have to know. Remember, it usually rotates anti-clockwise, while cecum usually rotates clockwise. Remember C for cecum, C for clockwise rotation. Okay, now moving forward, the next question. See, there is a 1-year-old boy who is passing red mucus per rectum. On palpation, the right iliac fossa seemed empty. What's the diagnosis? I guess all hints already given. Yes, we are dealing with a case of intussusception. Intussusception means telescoping of one bowel loop into the other. Remember, here the red mucus is known as the red currant jelly stool, and the empty right iliac fossa is named as the dance sign. Now, we did his barium enema. Why? Because barium enema is both diagnostic and therapeutic. Therapeutic enema can also use pneumatic reduction, that is using air. Now see this diagram. Appreciate the claw sign or the pincer sign of intussusception. This is due to the arrest of barium at a cylindrical filling defect with a thin rim of barium on either side. Remember, barium enema is contraindicated in case of intussusception if intussusception is accompanied with perforation, strangulation, pathological lead point, or recurrent intussusception. Here, we treat the patient with resection and anastomosis. Also, remember, the investigation of choice for intussusception is not barium enema. It's ultrasound in case of children. In USG, we see target sign or donut sign. See this ultrasound picture. There is a target. This is known as the target sign or the donut sign. And in case of adults, the investigation of choice for intussusception is contrast enhanced CT scan. Now the next question. We have a 45-year male presenting with chronic constipation for last few years. We did his barium enema and what we found? See this, it just looks like sawtooth. This is the sawtooth appearance of colon. The diagnosis is? Yes, that's diverticulosis of colon. There are multiple diverticula, but remember, no inflammation. Remember, barium enema is the investigation of choice for this condition. Now few words about diverticulosis. These are acquired diverticula. Remember, these are acquired, not congenital. These are false diverticula. Why false? Because these are composed of mucosa only, not all the layers of the intestine. And they appear on the mesenteric border of the intestine. Okay, we know diverticulosis, then we should know what's diverticulitis. Okay, when this diverticula gets inflamed, they may lead to complications like abscess, perforation, etc. If it occurs on the left side, the patient presents with lower abdominal pain on the left side with features of fever and diarrhea. And if it occurs on the right side, symptoms mimic that of appendicitis. Investigation of choice for diverticulitis is contrast enhanced CT scan, not barium enema. Please learn the Hinch's staging system for diverticulitis. In fact, one question was asked on this staging in this NEET 2020. So just basics, okay, you should know. Stage 1. Stage 1 is colonic inflammation with pericolic abscess. Stage 2 is colonic inflammation with pelvic abscess. Stage 3 is purulent peritonitis and stage 4 is fecal peritonitis. Remember, stage 1 and 2 is managed by USG guided pigtail drainage and stage 3 and 4 are treated by Hartmann procedure. That's all about this topic. Now moving forward. Next, I want to tell you about ulcerative colitis. Remember, rectum is the most common site. There is proctitis, means inflammation of the rectum first, which later leads to pancolitis, means inflammation of the full colon. There is continuous involvement of mucosa. Because of the chronic inflammation and fibrosis, the ileocecal valve opens due to the push, which leads to spillage of disease to the ileum, also known as backwash ileitis. Remember, because of the irreversible fibrosis, that is the sign of chronic inflammatory bowel disease, and the spasm of longitudinal muscles, there is shortening or narrowing of the colon, with loss of hostrations. This is known as the lead pipe colon or the pipe stem colon. Now see this barium enema film. Can you appreciate the ahostral lead pipe appearance of colon? This is a case of ulcerative colitis. Remember, toxic megacolon occurs when IBD causes the colon to expand, dilate and distend due to the damage to the nerves and muscles. Also remember, mucosal granular appearance is the earliest sign of ulcerative colitis. And what's the earliest sign of Crohn's disease? Yes, that's aphthoid ulceration. Now moving forward, we have a baby diagnosed with Down syndrome having non-passage of meconium and abdominal distension. You as a pediatrician did digital rectal examination with your little finger and the baby passed meconium. This is a typical case of, yes, that's hirschsprung disease. Here, digital rectal examination acted as the mechanical stimulus. Now, what's hirschsprung disease? This is a condition where ganglionic cells, that are neural crest cells, in Auerbach's and Meinrich plexus of the colon and rectum is absent. That is, a neural crest cell migration defect. Remember, rectum is always involved. The segment lacking the neurons become constricted, causing the normal proximal section of the bowel to become distended with feces. We did barium enema for this child. Here is what we get. There is a megacolon, that is hugely dilated colon. Remember, most important sign on barium enema is sudden change of caliber from narrow aganglionic segment and the dilated proximal bowel. Also remember, barium is diluted in saline here, not water, to prevent water intoxication from absorption in the megacolon. And one more, just see this picture. What does this film remind of? Okay, yes, that's apple core. We saw that in carcinoma esophagus barium swallow film as well. Okay, in colon, this apple core appearance suggests that it can be a case of carcinoma colon. Okay, it's time for revision now. You just have to tell me the sign name and the diagnosis. The first picture, yes, that's coffee bean sign on X-ray abdomen. Diagnosis, sigmoid volvulus. See the second picture, the bird beak sign on barium enema. Diagnosis, sigmoid volvulus. The third picture, claw sign on barium enema. Diagnosis, intussusception. Target sign on USG. Diagnosis, intussusception. Sawtooth appearance on barium enema. Diagnosis, diverticulosis. Lead pipe colon on barium enema. Diagnosis, ulcerative colitis. Megacolon on barium enema. Diagnosis, hirschsprung disease. And apple core appearance on barium enema. Diagnosis, carcinoma colon. That's all for today. Hope you enjoyed this session. Ask your doubts in the comment section and subscribe to my channel. Thank you.